Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome, ladies and gentlemen, to a special coverage of For Them episode with myself, Sylman. We are here joined at location regarding the King Salman Center for Disability Research, especially doing coverage of individual disability and many amazing research centers that are going a lots of assistance for the individuals with disability and their life to live a more healthier and, of course, a more way of life contributing back to society. We're going to be joined with a very esteemed guest, Dr. Sultan Turki Al-Suderi, who is a member of the Board of Trustees. Assalamu alaikum. Thank you so much for joining us. Dr. Sultan, King Salman Center for Disability Research is something that's very important here in the Kingdom of Saudi Arabia, especially regarding society's aspect. Individuals with disability, unfortunately, anywhere around the world, they seem to be kind of disregarded or kind of overseen. But here in the Kingdom of Saudi Arabia, the King Salman Center has done so much. Tell us about what is the center about, what's the vision, and what's its goals?
The King Salman Center for Disability Research was created many years ago. As you are aware, Prince Sultan bin Salman was involved in the disability issue for many years with regard to the Disabled Children Association. He found out that many times you find the same disability coming to the Center for the Disabled Children Association.
Indeed.
And different name, but with the same disability, the same cause, the same consequences. So he formulated an idea while he was piloting his jet on creating an entity that can address disability in a scientific manner. And what I mean by that is creating a center that does disability research that addresses the causes of disability as well as means by which we can overcome the consequences of disability. So the center was created with a particular mission to address the disability issue from prevention into inclusion of the disabled, elevation of the causes or the consequence of disability. Throughout the years, the center has formulated a number of programs that touches the lives of the disabled and their family and the society as a whole. The first program that was launched and has done a major consequence in prevention of disability was the metabolic screening, the neonatal screening. Every child that is born in Saudi Arabia is screened for a number of diseases that causes disability, thus identifying these diseases early on and then provide a means by which you can treat them in a proper manner. These diseases are metabolic diseases, the absence of certain enzymes in the body of these children who cannot metabolize the food in a proper manner, by which the toxic consequences is created. It goes to the brain, it causes atrophy, it causes major disability in many of these children. By testing them and having food restriction and special diet, these children grow up to become normal and they go with their life as a normal being, and many of these children have graduated college and they are normal members of the society who are contributing significantly. Currently, this test is offered to all the hospitals in the kingdom in relationship with many partners in many of the health institutions in the kingdom. We have been able, by conducting such a program, to prevent disability in a huge number of children who are now normal, and thus alleviating the consequence of disability and the stress on the family, as well as saving major amount of funding that is would have been spent on ICU and medical treatment for these children.
Indeed. And Doctor, I've noticed that the Kingdom of Saudi Arabia has allocated a lot in research and prevention as a way of cutting costs, especially into the duration. And it seems like it's working, mashallah. I've seen a lot of development and improvement, especially in the Kingdom of Saudi Arabia, compared to many of the research and healthcare around the world.
The center has have a philosophy of reaching out to all partners in various sectors in the government and in the private sector as well. We believe in coalition formulation is the proper mechanism by which we can tackle the issue of disability. By saying this, what I mean is that we have signed a number of memorandum of understanding with all the ministries that are responsible for providing services to the disabled, whether it is the Ministry of Health, Ministry of Education, Ministry of Social Work, Ministry of Labor, and all the organizations that are involved in providing services in healthcare and in education and employment. By signing such agreement, you formulate a coalition that work in synchronization with each other to be able to provide the maximum amount of services with an efficient cost. As you are aware, most of the waste that takes place is when you have different organizations working on the same objective individually. When you align them all together, it makes more sense
and communication
in terms of efficient utilization of resources, thus cutting down on the cost of acquiring the objectives that is required. By doing so, we have been able to really select capabilities from various governmental agencies, academic institutions, to formulate groups that can tackle issues for the disabled. Another program that the center has done, which is of great importance, is the capabilities to allow these individuals with disability, that which you could not prevent. These are individuals who need to be integrated and needs to be included in the society by formulating a major program which is one of its kind in the whole region, by assembling a team of experts from all over the world to address the issue of accessibility. What I mean by accessibility, accessibility to the workplace, accessibility to the
everyday life to make it easier.
Places, accessibility to education, accessibility to health, accessibility to work, accessibility to entertainment. And when you formulated the what we call the accessibility code, which has been composed by experts from around the world, looking at the experience that has took place in many places in the world, East and West, in the US, in Europe, North America, Europe, Asia, Japan, and we assembled a distillate of experiences that existed elsewhere and formulated the Saudi Code for accessibility, and this is in 5 volumes with regard to various issues with regard to accessibility, and it is shared by all the governmental agencies, and it was also included in the code of for building in Saudi Arabia. This accomplishment could not have done without the cooperation and collaboration with many governmental agencies, including the governance in various regions in Saudi Arabia, by which this program was presented during their government, what you call council, and having the support of all the governors to implement such a program in their own regions.
Indeed. And Dr. Sultan, Hajj is something that's considered for any Muslim around the world, the 5th pillar of Islam, something every individual wants to go ahead and perform. A special needs individual, they are keen and very eager for them to perform it once in their life. Tell us about some of the facilities or some of the assistance that's offered for individuals with disability for the Hajj pilgrimage.
Yeah, of course, as a consequence of the formulation of the accessibility code, or the accessibility program, there has been a memorandum of understanding that has been signed between the center and the Mecca region and also Medina region to implement this program in the Al-Haram al-Makki and the Al-Haram fil Medina. And we have received a very positive welcome from all the responsible people in those 2 areas to implement such a program to allow people with disability to perform whether Hajj or Umrah or Ziyarah in Medina in a very easy, accessible manner with all the tools and the supportive technologies that can allow them to perform their holy duties in a very easy and comfortable way.
Indeed. And Dr. Sultan, I've noticed that the Kingdom of Saudi Arabia, especially the King Salman Center for Disability Research, I've noticed a lot of individuals, when they say they're disabled, I feel like they're achieving much more than individuals with no disability. They are able to shine, they're able to succeed, they are able to exceed the benchmarks of the individuals with no disability. Is it something that when someone has a disability, that means they are showing to the world their capability and to give back to society even more contribution than a regular individual?
I think it's a matter of the social stigma that we have with regard to people with disability. All of us, we have disability in one way or another. I myself, I am disabled because I cannot read without using my glasses. I am disabled that I cannot really jump a big jump or take stairs in a very easy way. So the disability varies, and the hindrances that we place on ourselves varies in relation to our will to really overcome this disability. But if we look in our society and other societies, we have people who God have given them the blessing of having a lot of capabilities, yet they are not performing to the level that you expect. And there are people that God have taken away from them either sight or hearing or movement, yet they have performed in a way that is much more advanced and productive than people who are. So we should not focus on the disability, but rather focus on the capability. Prince Sultan bin Salman always talk about people with special capabilities rather than disability, because we should not look at what people are disabled about, but
focus
rather
on what they
are
can do.
capable
Indeed.
of doing.
Indeed. And one thing, Dr. Sultan, I've noticed that community support and community assist is something that's very, very important, especially here in the Kingdom of Saudi Arabia. We always want to make sure that we are helping our neighbors, we are helping the individuals that even we don't know. How important is this in, for example, in the life of an individual that has some type of disability? How important is the role of the community, no matter how close or far away they are? The importance of the community environment and role in a disabled life.
You know, in Islam, the complementation and the work and the collaboration between members of the society is one of the duties of every Muslim. People who are rich, they help the poor. People who are able, they will help disabled. And that social responsibility is engraved in our belief in Islam and engraved in our also our what I call social values. One of the indication of the development of nations is the complementation that exists between governmental agencies and NGOs such as King Salman Center for Disability Research. We are complementing the Ministry of Health with many programs that they are doing. We are complementing the Ministry of Education with many of the programs they are doing. We are complementing Ministry of Labor with many of the programs they are doing. We are complementing many of the organizations in various areas with what they are doing. So the complementation that exists between NGOs and governmental and non-governmental agencies is one of the key factors that makes the society succeed collectively in a very formalized manner, by which we can assess the need and formulate the requirements and also execute in an efficient and productive manner.
Indeed. And of course, Dr. Sultan, For the King Salman Center for Disability Research, I've noticed is one of a strong backbone for the development and the growth here in the Kingdom of Saudi Arabia, whether as you mentioned for Minister of Education, Minister of Labor, anything that I've seen that there's growth, I've noticed that the King Salman Center has definitely been. For example, for the Hajj, this is something that's very important. Your cooperation and your expertise and your, of course, your continuous assistance for individuals performing Hajj, especially when disabled, takes a lot more efforts and work. How do you feel that the continuous growth and development is seen every year, and of course day to day here in the Kingdom of Saudi, but every year we've seen that the Hajj facilities offered by the amazing King Salman Center for Research, it's quite amazing, and people are seeing it, even individuals from all around the world.
Yeah, of course, you know, as you know, there is the formulation of the program, and then there is an implementation of the program, and then the sustainability of the program. What the King Salman Center for Disability Research have done a lot of effort in formulating the accessibility code. And then we have done a lot of work with Prince Sultan bin Salman, working diligently with many of the governors, with many of the ministers for the implementation of this code. And then we are following up to sustain this program with updating, training, and also review the, the problem that are facing us in the implementation and the best utilization of this code.
Indeed, it's something that I feel like, you know, the more people are involved, the more people that are contributing back to or being assistant, as I would say, volunteers, especially the younger generation. 70% of the youth population are 30 years old and below. How do you feel that they will able to go ahead and continue the amazing services that's been offered by King Salman Center?
Of course, King Salman Center for Disability Research does not offer services. We are not service provider. We are formulating, we are the formulator of the ideology of progress. We are formulating and innovating the methodology by which you can prevent disease by early screening, prevention with regard to, in association with the Disabled Children Association, like the program with regard to the seat belt, the awareness, the traffic accidents, and so on. We are formulating with program prevention of the incident that takes place in the house with regard to some of the children that causes disability. We are formulating programs in regard of prevention of any birth defects due to wrong practices by mother who are pregnant in the early months of pregnancy. We are formulating programs by identifying children who have learning disability. We are formulating programs. I mean, like when you talk about disability, we are always focusing on people who are blind, people who are deaf, people who are physically disabled on wheelchair. But there are disabilities that are hidden disabilities that people don't see. These are disability of learning disability, dyslexia, attention deficit disorder. There are disability, the mental illness, which causes a lot of disability in terms of daily chores, daily living, such as depression, such as bipolar disease. There are a lot of mental illnesses that are undiagnosed, undetected, unknown, and people will think that there is no chemical imbalance in those individuals, or there are genetic diseases that causes these kind of medical conditions. And always you need to raise the awareness of people of the presence of such things. We work very hard on raising the awareness of the public about these things. Awareness for the parents who can detect these characteristics that can give them an alarm to seek medical attention or psychological help or psychiatric help or educational help to prevent. Because the more, the faster you identify the problem, the easier it is for you to solve it. And the easier to solve it means you prevent many people.
Prevention is the key.
From becoming rather than a burden on society, so they become actually an effective members of society.
Indeed, and definitely thank you so much, Dr. Sultan. You definitely clarified and, of course, gave us lots of more insights regarding the King Salman Center. Any final words or message you would like to tell our dear viewers?
The King Salman Center for Disability Research was an idea that came from His Royal Highness Prince Sultan bin Salman. This idea grew to become an institution that has national and international presence. The King Salman Center for Disability Research has been recognized by many international organizations and been awarded a number of prizes due to the work that is done. And the work that is done by King Salman Center for Disability Research is the work of many partners from many governmental agencies and many individuals who took the issue of disability as something dear to their hearts. What has been accomplished could not have been accomplished without the generous support of many of our founders, who are not only contributing financial contribution, but also contributing their time and their connection and their ideas and their experience in making sure that the King Salman Center for Disability Research achieve the objectives that has been set for it. And without the support and the involvement of many of the disabled, by hearing their issues, by hearing their ideas, we're being able to accomplish what we have accomplished throughout the years.
Indeed, and definitely thank you so much, Dr. Sultan, for joining us today, especially on the amazing contribution and, of course, the amazing background and the future contribution for society. Our dear viewers, that's Dr. Sultan Turki Al-Suderi, who's a member of the Board of Trustees, discussing more about the King Salman Center for Disability Research, especially regarding their assistance to society and, of course, for pilgrimage to perform Hajj.
لك والملك لا شريك